एक मूवी है थ्री इडियट्स, उसमें वो कहते हैं कि हम पेशेंट या उनके फैमिली से कोई रिलेशनशिप बिल्ड नहीं करते हैं, ज़्यादा बात नहीं करते हैं क्योंकि वो इमोशंस अटैच हो जाते हैं.
Then you see the emotions in their patients' faces. Then you really feel their emotions.
Is Chhattisgarh prepared? Is Raipur prepared to conduct major surgeries?
Same way we perform a lot of young babies with complex defects, and we have performed babies with artificial valves. I'm not saying you should be wholly dependent on whey protein powder. There are companies which are good. Many times ECG और echo में हमको पता नहीं चलता है. We will have to do a stress test, what is called TMT.
वेजिटेरियंस के लिए सुपर फूड्स कौन से हैं हार्ट के लिए? सर आपको पता ही होगा, इंस्टाग्राम और सोशल मीडिया में काफ़ी ज़्यादा डॉक्टर्स आ गए हैं, सेल्फ क्लेम, जो डॉक्टर्स नहीं हैं बट दे आर इन्फ्लुएंसर्स. एंड कुछ लोग ऐसे सजेस्ट करते हैं कि यू टेक एक पीस अगर आप गार्लिक का लोगे रात के एंड योर हार्ट विल बी हैप्पी एंड गुड.
Basically, alcohol is not good for the body. Sometimes it mimics gastric symptoms. If you have a lot of belching, acidity, indigestion, even that can be a symptom of heart disease. You can travel, you can walk for 1 or 2 kilometers easily without any breathing difficulty. Suddenly, if the same person develops a breathing difficulty in the same kilometers, then it has to be careful.
क्यों हो रहा है हार्ट अटैक? तो क्या इसका रीज़न, कई एक्सपर्ट भी बोलते हैं और कई लोग भी बोलते हैं, क्या इसका एक रीज़न वैक्सीन हो सकता है, कोविड वैक्सीन? आजकल के भागदौड़ की ज़िंदगी में स्ट्रेस और बदलती लाइफस्टाइल की वजह से हार्ट हेल्थ काफ़ी बड़ा कंसर्न बन चुका है. छोटे छोटे बच्चों को हार्ट अटैक आ रहा है और इन्हीं सब चीज़ों पर आज हम बात करेंगे. हमारे साथ मौजूद हैं डॉक्टर हरी, जो सीनियर कार्डियक सर्जन हैं MMI हॉस्पिटल में. सर आप कैसे हैं?
Yeah, good, thank you.
सर सबसे पहले तो मैं आप ये जानना चाहूँगी कि आपका बॉर्न एंड बॉटअप कहाँ हुआ है, आप रायपुर में कब शिफ्ट हुए और आपका एक्सपीरियंस थ्रू आउट द जर्नी कैसा रहा बीइंग अ कार्डियक सर्जन?
या बेसिकली मैं बेंगलुरु से हूँ. मेरा नेटिव प्लेस है मैसूर, इट्स कर्नाटका. सो आई डिड माई स्कूलिंग, सब स्कूलिंग वही किया मैं. और देन आफ्टर बिकमिंग ए कार्डियक सर्जन में नारायण हवियाल के साथ एसोसिएटेड हूँ for almost like last 15 years. So my main reason coming here is was Dr. Devi Shetty sir. He wanted me to come to Raipur and set up the unit here. So he is the main reason for me coming here.
ओके सर, आपको बचपन से ही पता था कि आपको डॉक्टर बनना है या फिर आपने कोई और पाथ चुना और यू एंड अप बिकमिंग अ डॉक्टर?
No, I wanted to become a heart specialist from the very young age. क्या हुआ, मैं 8 साल था, मेरा मदर का डेथ हो गया. सो वी वेयर इन हासन, इट्स अ 2-tier टाउन. Then I came to know she died because of a heart disease. So that time I made up my mind that whatever I want to do is I want to become a heart specialist. So that's I didn't have any other options. So I just wanted to become a heart specialist. That's how I became one. And I'm lucky and blessed to have become what I wanted to be.
नाइस. सर मेडिकल फील्ड खुद ही एक बहुत बड़ा चैलेंज है. जो MBBS करते हैं, MD करते हैं, नॉर्मल जो जेनरिक सर्जन भी होते हैं, उनके लिए भी बहुत बड़ा टास्क रहता है. बट बीइंग अ स्पेशलिस्ट इन सर्जरी, वो भी हार्ट, तो ये कितना चैलेंज भरा है आपका जॉब, स्पेशली मेंटली?
Heart surgery itself is a very challenging subject actually. हम जो भी पेशेंट को ऑपरेट करते हैं, छोटे बच्चे, अडल्ट, सी वी आर answerable to the whole family. The whole family is anxiously waiting for the surgical result, after the surgery. So we are answerable for the whole family. So it is quite stressful that we are answerable to these the family and all that, because cardiac surgery का एक ही complication है, that is death. There is no other complication. So if there is a problem, there is only one complication that can happen. So we are always on our toes. We have to be very careful. And cardiac surgery एक specialty है where there are 5 teams involved in cardiac surgery. एक तो surgeon of course most important thing role he plays. Second thing is we have हार्ट सर्जरी anesthesia called as cardiac anesthesia. वो कार्डियक anesthesia एक अलग ही टीम है, वो भी स्पेशलाइजेशन है. और उसके बाद हार्ट लंग मशीन, हम ऑपरेशन करने के लिए ओपन हार्ट सर्जरी करते हैं ना, उसके लिए हम हार्ट लंग मशीन चाहिए. सो हार्ट लंग मशीन रन करने के लिए एक that's itself another specialty, that's called perfusion. So we have a perfusion team, we have an anesthesia team, and we have an OT team. उसके बाद हार्ट सर्जरी के बाद पोस्ट ऑप केयर इज़ वेरी 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 इंपॉर्टेंट, बिकॉज when we perform a complex surgery, हार्ट कैसे रेस्पॉन्ड करते हैं वो देखना है. सो इसलिए द नेक्स्ट 24 to 40 hours is very very critical. So the post op team, our ITU nurses, ITU doctors, they play also a very important role. So cardiac surgery is dependent on all these 5 teams. Any member in any one of these teams make a mistake, then there is a complication. So most important thing is in a cardiac surgical team, we need to have all the teams performing well and a very good experienced team give the results. Of course, whatever happens is of course decided by him, but we have to give 100%. So we need a proper team for that. That is why it is very stressful.
करेक्ट सर. मैंने जैसे पढ़ा है कि हार्ट की जो सर्जरी होती है वो काफ़ी घंटों तक होती है और काफ़ी कॉम्प्लिकेटेड होता है, जैसे आपने बताया. मैं कंपेयर नहीं करना चाहूँगी, लेकिन अगर बोन में कुछ थोड़ी बहुत गड़बड़ी हो गई तो वो बाद में फ़िक्स किया जा सकता है. जो नॉर्मल खांसी ज़ुकाम होता है वो भी बाद में ठीक किया जा सकता है, फिक्स किया जा सकता है. लेकिन अगर हार्ट के साथ कोई भी कॉम्प्लेक्स चीज़ें हो गई तो फिर द पर्सन इज़ गॉन. सर, आपको आपके इतना बड़ा करियर है, इतना टाइम आपने स्पेंड किया है इस इंडस्ट्री में, सर आपको कोई 1 या 2 इंसिडेंट ऐसा याद है, इफ़ यू रिमेंबर, कि ये बहुत ज़्यादा कॉम्प्लिकेटेड सर्जरी था बट मी एंड माई टीम हैव डन इट?
Yeah, we do a lot of complex surgeries. One surgery which I can remember recently, about 6 months back, which I did was aortic dissection बोलते हैं. वो क्या है, हमारा हार्ट एक बड़ा नस रहते हैं हार्ट के ऊपर, वो पूरा टेढ़ हो गया था. सो उसको हम पूरा बदलना पड़ेगा. एंड दैट artery supplies the brain, the kidneys, the whole organs of the body. So that the patient came to us at around 6 o'clock in the evening, and we needed to operate him immediately. The patient was very sick, BP भी नहीं था, and he was a relatively young patient, a 50-year-old patient था, and I could see the anxious family members, and they could not take him also anywhere outside, because they can't go to Bangalore or where usually these surgeries are performed. Luckily हमारा हॉस्पिटल में ऐसे कॉम्प्लेक्स सर्जरीज कर रहे हैं. सो दिस सर्जरी वी स्टार्टेड अराउंड 8 o'clock in the night, और पूरा रात I kept on operating. The surgery went on till next day 12 o'clock noon. So it was a very long surgery. The whole team members were tired, and then after that, the post-op period, everything went on well. So luckily, and after 2 days, when I saw the patient, it felt so happy and satisfying. The patient was walking in the ITU, and looking at the family members after that, looking at their faces, the anxiousness turned to smiles. So as a heart surgeon, what I believe is the greatest most satisfying thing which I get is the smile on the family members' faces after the patient gets better. So that was one case which I am really happy that everything went on well, and I'm happy that I have a supportive team in the hospital.
करेक्ट सर. लोग सच कहते हैं कि भगवान का दूसरा रूप ही आप लोग हो, डॉक्टर्स एंड सर्जन्स. सर, एक मूवी है 3 Idiots, उसमें वो कहते हैं कि हम पेशेंट या उनके फैमिली से कोई रिलेशनशिप बिल्ड नहीं करते हैं, ज़्यादा बात नहीं करते हैं, क्योंकि वो इमोशंस अटैच हो जाते हैं. लेकिन आपने अभी बताया कि उनको देख के बहुत अच्छा लगा कि उनका फैमिली मेम्बर ठीक से काम कर रहा है अब. तो ये इमोशन को मैं जानना चाहती हूँ सर कि एज अ सर्जन आप लोग कैसे क्या फील करते हैं जब पेशेंट को आप ऑपरेट करते हैं। एक तो टेंशन रहता ही है कि ऑपरेशन कैसा होगा, प्लस इतना हेक्टिक आवर्स, एंड देन थर्ड कि बाहर ऑपरेशन थिएटर के बाहर एक फैमिली है जो इंतज़ार कर रही है कि हमारा जो मेंबर है वो बच पाएगा या नहीं। हाउ डू यू डील विद दिस इमोशन?
Yeah, it's a very complex thing actually. Uh, I try to not to get emotionally involved in the patients with the family members and all that, but it's हम अवॉइड नहीं कर सकते क्योंकि when we sit and talk to the patient's family members about the patient condition, उनका क्या चल रहा है, उनका क्या ऑपरेशन करना है, then you see the emotions in their patients' faces, then you really feel their emotions. So it's very difficult to be very, not an emotional person. You really get emotionally involved as surgeons, and sometimes it really affects us if something happens to the patient, how to tell the family members, and but as I told you, after all these things, the smiles we get from the patient family members, and suppose we operate on a small child, small babies, we operate on babies starting from 5 kgs to adults aged almost 85 years. So it's a nice feeling when the patient goes home, and sometimes of course we get emotionally involved, and sometimes हम घर जाने के बाद भी हम पूरा stress में रहेंगे, with our family members also sometimes we want to spend a good time thinking about the patient. But at the end of the day, everything goes on well, and we feel very happy when the patient goes home, and everything is worth it, you know. So it's a complex thing.
सर यू हैव मेंशन अबाउट फैमिली, तो आपका जॉब जो है वो बहुत चैलेंजिंग है एज यू सेड, लेकिन कभी कभार आपको भी ऐसा फील होता होगा, फैमिली आपने जैसे बताया कि घर वालों के साथ भी टाइम बिताते वक्त आप याद करते हैं कि उस पेशेंट की हालत शायद ठीक नहीं है, तो हाउ डू यू मैनेज योर वर्क लाइफ एंड योर पर्सनल लाइफ?
Yeah, it is sometimes difficult to manage, but now I almost got used to it. For that, I have to thank my family, especially my wife and my children. I have never been at the home many times, and sometimes I'm not there for the birthdays. Sometimes I'm not being there for functions. So my wife takes care of everything. So she is my biggest support. And of course, my father, my parents, my sisters, they're all there who support me so much. Without family support, it's very difficult to perform this kind of stressful operations. You need a very big family support, and mentally, I'm telling. So I'm happy, I'm lucky, blessed to have my wife, my children, my parents, and my sisters. At the same time, usually मैं क्या करता हूँ, जो भी होता है हॉस्पिटल में, जो भी stress हो जाता है, I don't bring it back home.
Nice. Sir, as you mentioned that you were in Bangalore for so many years and currently you are functioning from Raipur. So, sir, हम भी जब डिस्कस करते हैं हमारी फैमिली में ऐसा कुछ होता है या रिश्तेदारों के साथ, तो वो बोलते हैं कि अब बैंगलोर चले जाओ या आप साउथ चले जाओ ट्रीटमेंट के लिए। सर मैं जानना चाहती हूँ स्पेशली फॉर हार्ट, इज़ छत्तीसगढ़ prepared, is Raipur prepared to conduct major surgeries?
Yeah, 100%. As a team, we have performed a lot of first surgeries in Chhattisgarh. हम सबसे पहले pulmonary endarterectomy surgery successfully किया है. That pulmonary endarterectomy surgery is performed only in few hospitals in India, NH Bangalore and 2-3 hospitals all over India, and that it was a very successful operation. Same way we performed a lot of young babies with complex defects, and we have performed babies with artificial valves, creating artificial conduits, and then as I told you, we did the first total arch replacement here. That's also very complex surgery. And now, and in our hospital, we have a very good team. And also we have a very good, the latest state-of-the-art technology like ECMO machines and heart-lung machines. So I can surely say that as far as heart surgery is concerned, we can perform anything here, and we have a very good team. And there is one more new technology called MICS, minimal invasive cardiac surgery बोलते हैं. MICS is a new technology which is not usually performed in many hospitals. It's a new technology. We are regularly performing MICS also here. And uh, so as I was telling you, there's a new technology called MICS in cardiac surgery. इसमें क्या है, हम यूजुअली ट्रेडिशनली क्या करते हैं, हम ओपन हार्ट सर्जरी तो हम सामने से करते हैं. वी हैव टू कट द बोन टू एक्सेस द हार्ट. दैट्स अ नॉर्मल ट्रेडिशनल cardiac surgery. It's a new technology where we can do cardiac surgery from the side, from a small incision, without cutting the bone. And this is a new technology where it leads to faster recovery or less blood loss, और पेशेंट जल्दी काम के लिए जा सकते हैं. So it's a good thing for the patient. We need extra instruments for that, extra training for that and all that. So we are doing MICS regularly here, which is a new technology where it's not done in many hospitals, all over India. Only few hospitals are doing it. And we are also planning to start robotic surgery in a month or so. So I can safely say that we are prepared to do any complex heart surgery in Raipur.
ग्रेट सर, कुडोज टू यू एंड योर टीम. सर, इससे पहले आपने मेंशन किया था अबाउट स्मॉल चिल्ड्रन. सर, आजकल हम बच्चों में भी देखते हैं, चाहे स्कूली बच्चे हो या थोड़े टीनेजर्स हो, वो कभी प्रेयर्स करते करते गिर जाते हैं और फिर पता चलता है कि द स्टूडेंट पास बिकॉज ऑफ हार्ट अटैक और कार्डियक अरेस्ट. तो सर, इतने छोटे बच्चों में क्यों हो रहा है हार्ट अटैक? सर, क्या इसका रीज़न, कई एक्सपर्ट भी बोलते हैं और कई लोग भी बोलते हैं, क्या इसका एक रीज़न वैक्सीन हो सकता है, कोविड वैक्सीन?
Cannot actually tell anything about कोविड वैक्सीन because हमारे पास एविडेंस नहीं है. वो सर ये सब वैक्सीन के कारण हो सकता है, हो रहा है, हमारे पास एविडेंस नहीं है. So without evidence based facts, it's very difficult to say, but we are seeing some more incidents regarding heart, regarding blockage in the arteries in younger people nowadays. और हम बच्चों के बारे में बात करेंगे तो यूजुअली देर आर टू रीजन्स. वन इज़ सम चिल्ड्रन आर born with defects. Some children are born with congenital defects. They might have a hole in the heart, or they might have some what is called as extra muscle in their heart, or a thick muscle which is called hypertrophic cardiomyopathy. यूजुअली ये सब ना यूजुअली हमारे स्कूल हेल्थ प्रोग्राम्स में स्क्रीनिंग में पता चलता है. But sometimes many of these kids, they're not detected, and this can cause problems in small children. Coming to younger adults, see, basically there are three things when you talk about general health as it is. There are three things. One is physical health, क्या बोलते हैं, हमारा external appearance. और सेकेंड इज इंटरनल हेल्थ. इंटरनल क्या है, हमारा बॉडी के अंदर ऑर्गन्स. और तीसरा क्या है, मेंटल हेल्थ. सो ऑल दिस थ्री कंपोनेंट्स ऑफ हेल्थ आर वेरी वेरी इंपॉर्टेंट. फॉर एग्जांपल, इफ आई टॉक अबाउट मेंटल हेल्थ, वी हैड एन एक्टर हु एक्चुअली hung himself recently, Sushant Kumar. Yeah, see, if you look at him, physically वो fit था, internally उनका organs perfect, but his mental health was not good. So we need to take care of all the three components. We need to take care of physical components, we need to reduce weight, and we need to maintain a proper weight, exercise regularly. That is physical appearance. Internal health depends on what we eat and what we drink. So हमारा body क्या है, we are what we eat and drink basically. So we have to be very careful in our diet habits. And of course, for mental health, we need to control our emotions, undergo some meditation and all these things. So we need to correct these three things and keep these three things in check to have a good health. Other example I'm telling you, the many people in the gym, the collapse when they're doing, and they are very fit people.
यही मैं पूछने वाली थी सर कि इतने फिट लोग जो होते हैं, वेदर यू टेक एग्जांपल ऑफ सिद्धार्थ शुक्ला और एनी अदर एक्टर और एनी अदर पर्सन, इतने फिट रहते हैं, वो जिम करते हैं, रोज़ प्रॉपर डाइट लेते हैं, बट पता चलता है कि एक सेकंड में दे पास बिकॉज ऑफ हार्ट अटैक.
That's what I'm telling you. All these three components are very important.
तो क्या जिम रीज़न है
नहीं.
और इज इट अ मिथ?
No, it's a myth. I'm telling you. See, there are so many factors which can cause heart disease or a heart attack. Of course, one is your body itself, where you're not taking a good diet, improper diet, junk food, or smoking, alcohol, stress now. There's a lot of stress everywhere. So all these things add together. And I'm telling you, if a patient looks physically fit, मैं इतना patients operate किया हूँ. I've operated on people who are very fit. I've operated on people, basically suppose if you take a farmer, he doesn't eat junk food. He doesn't have pizza in his village, or he doesn't drink Coca-Cola or Thumbs Up. So there's something called as genetics also. So genetics also play a very important role. And our other lifestyle diseases like hypertension, diabetes, our stress, all these things matter. And whenever you want to start doing exercises, it's always better to assess your health first. हमारा genetic history क्या है? हमारा parents, हमारा brothers, sisters, are they healthy? Do they have heart disease? Do they have diabetes? Do they have hypertension? If they have, then we'll have to be careful, because you are bound to get it. You have this inclination to get it. So you'll have to be careful. You have to assess yourself before you start some vigorous exercise. पहला हमारा body, we have to make sure our body is fit to withstand that vigorous exercise. And it's very important to not to look for short-term results. अभी शॉर्ट टर्म रिजल्ट्स के लिए क्या कर रहे हैं लोग, तुरंत एक्सरसाइजेस को बढ़ाते हैं विदाउट, इट इज़ नॉट अ स्लो प्रोग्रेस. दे इंक्रीज द एक्सरसाइजेस exponentially, and they have this protein powders and steroids to increase their muscle fitness and all that, which is not a very good thing.
So protein powder safe है for heart?
There are some protein powders which are okay. I'm not talking about for the heart, I'm talking about for general health. If you are building muscle, if you want to have muscle, you need to be very careful in what you're eating. The best form of proteins as of now is an egg, because the biological value of the protein is very good. And other than that, we can have non-vegetarian food. Even vegetarian food, we have paneer, we have pulses. There are a lot of proteins, soya.
सर लेकिन अगर मैं भी जैसे जिम जाती हूँ, आई एम अ वेजिटेरियन, प्योर वेजिटेरियन, तो वो प्रोटीन इंटेक पूरा हो ही नहीं पाता है. इफ़ आई एम टेकिंग लाइक 70 ग्राम्स ऑफ प्रोटीन, द जिम ट्रेनर डू सजेस्ट मी कि आपको प्रोटीन पाउडर लेना ही पड़ेगा. और वे प्रोटीन तो बहुत कॉमन हो गया है सर. ऐसे में लाइक इज इट अफेक्टिंग आवर हेल्थ?
I'm not saying you should be wholly dependent on whey protein powder. There are companies which are good, and these should be from certified company, where they are certified from other companies, from the nutrition bodies. If they are certified and they are from good companies, they are safe. But after that, you will have to be very careful that you should not depend on only proteins only on them. Of course, we have vegetarian, we have so many proteins available. We have paneer is there, we have soya bean, we have pulses, tofu is there. There are a lot of options. So you need to make sure you have all of them, and make sure you're not dependent on only one source. So many of them depend on only one source of protein. Sometimes they just keep on taking whey protein powder, which is not very safe thing. So it's, you need to have a variety of sources for everything.
सर आपने जैसे बोला पहले कि यू नीड टू असेस योर बॉडी बिफोर यू नो गोइंग टू अ जिम या जो भी अगर आप हैवी वर्कआउट करना चाहते हैं तो सर मैं अपनी ऑडियंस के लिए चाहती हूँ आप बता दें 2 या 3 टेस्ट जो कंपलसरी है अगर आप वर्कआउट करते हैं तो भी और अगर नहीं करते हैं तो भी मतलब अगर मैं अपने पेरेंट्स की बात करूँ या मेरी बात करूँ या मैं अपने छोटे भाई बहनों की बात करूँ हर एज ग्रुप के लिए.
See, anybody after 25 years, if your parents are hypertensive, आपका पेरेंट्स में बीपी है, शुगर है, और आपका पेरेंट्स और सिबलिंग्स मतलब ब्रदर सिस्टर्स, they've had heart disease at a very young age, you'll have to be very careful. You'll have to check your sugars, you'll have to check your, because I have patients, have a patient, 30-year-old patient who was had a heart attack and I have operated on him last week. A 30-year-old patient. He had हार्ट के ऊपर 3 नस रहते हैं, तीनों नस उनको ब्लॉक था. He's a 30-year-old patient. So first thing you will have to assess your genetic history. Our second thing is, if you have diabetes, if you have hypertension, it's very important that you keep them under control by doing regular exercise and taking medicines and doing a complete body checkup at least every 5 years after 25 years. Every 5 years after 25 years. If you find any issues, then you will have to decrease the frequency. But whatever said and done, after 40 years, I usually tell most of my friends, my relatives, after 40 years, better to get a complete heart checkup done. Heart checkup doesn't only mean ECG or echo, because many times ECG or echo में हमको पता नहीं चलता है. We will have to do a stress test, what is called TMT. We will have to undergo a stress test. If in that stress test, if you find any abnormality, then we will have to undergo an angiogram.
Okay.
If you have any symptoms, like vague symptoms like chest pain, or unusually you are feeling very tired, like initially maybe 6 महीने पहले आप पूरा 6 days 3-4 days आप चल सकते थे, बट अभी आपको थोड़ा तकलीफ हो रहा है, अभी आपको सांस फूलता है. So that time you will have to take care. You will have to see why it is happening to me, even if you are 40-year-old. You'll have to make sure you have to undergo all these kind of tests. And then if there are no abnormalities seen in these 3 tests which I told you, and if you still have a doubt, if you're still having some chest pain, left-sided chest pain, और थोड़ा हार्ट का symptoms है, it's always better to get a CT angio done, cardiac CT angio done. That gives a proper result, of the arteries on the heart, how the arteries are looking, calcium है या नहीं, कुछ blocks हैं, वो हम CT cardiac CT में पता चलता है. So that's how we should go about.
सर आपने बता दिया कि कौन कौन से टेस्ट कराने चाहिए. अब मैं आपसे जानना चाहूँगी कि कौन कौन से वाइटामिन्स हैं या मिनरल्स हैं जो हमें डेली बेसिस में लेना चाहिए, या इस पर्टिकुलर वाइटामिन की डिफिशियंसी तो बिल्कुल नहीं होनी चाहिए, वो मैं आपसे जानना चाहूँगी. और साथ ही वेजिटेरियंस के लिए सुपर फूड्स कौन से हैं हार्ट के लिए?
Yeah. Generally most of the vitamins or minerals हमारा normal food में रहते हैं. Thing is, it is always better to eat at least 3 types of vegetables and 3 types of fruits in a day. So this will give us most of the vitamins which is there and most of the minerals which we need. We don't need supplements. But if you're not taking a complete balanced diet, it's always better to take vitamin supplements. Or one more thing is which is good for the heart is omega-3 fatty acids, which are good to reduce the cholesterol. So usually sometimes I recommend my patients to take vitamin supplements, omega-3 fatty acids as part of the diet. But all this is present in our normal diet. So if you're not taking a good balanced diet, you can take this as supplements.
सर आपको पता ही होगा इंस्टाग्राम और सोशल मीडिया में काफ़ी ज़्यादा डॉक्टर्स आ गए हैं, सेल्फ क्लेम्ड, जो डॉक्टर्स नहीं हैं बट दे आर इन्फ्लुएंसर्स, एंड कुछ लोग ऐसे सजेस्ट करते हैं कि यू टेक एक पीस अगर आप गार्लिक का लोगे रात के एंड योर हार्ट विल बी हैप्पी एंड गुड, तो इज इट अ मिथ और इट इज़ ट्रुथ?
Yeah. See, garlic is good for the heart, basically. उसमें एक एक्टिव कंपाउंड है, एलिसिन बोलते हैं. So it actually it relaxes the blood vessels. It also reduces the cholesterol. Having said that, we cannot depend only on garlic to prevent heart disease. See, there are so many other things. We need to, of course, garlic is good. Even my father used to keeps taking garlic every day. My grandfather, I've seen. Many of my members, elder members, they keep taking garlic every day. It's good for health. Basically, you can have it every day. It doesn't harm you. It's also good for the heart, but you should not be dependent on only that. There are so many other things, like you need to take a other proper diet. You need to take fruits, vegetables, fiber, proteins, and do some regular exercise, and reduce your stress, do some mental relaxation exercise. So all these things add together. So I won't say just taking one piece of garlic a day will reduce your heart diseases.
करेक्ट सर. सर जो अल्कोहल कंज्यूम करते हैं वो कोई ना कोई लूप होल निकाल लेते हैं अल्कोहल कंज्यूम करने के लिए. तो एज आई सेड, मैंने एक और इंस्टाग्राम रील देखी थी जिसमें एक मैम बता रही थी कि इफ़ यू आर ड्रिंकिंग अल्कोहल प्लीज़ refrain from consuming any other alcohol, but you can go for wine and you can go for gin because it is good for heart health. So इस पर आपका क्या take है?
Basically, alcohol is not good for the body. But we have recommendations from health associations. We have American Association, British Health Association. They recommend, if you take a 30 ml of one peg a day, it doesn't matter. It relaxes your mind and all that. Basically, I would say all the alcohol is the same. There's nothing like gin, wine, or whiskey, beer. All the alcohol is the same. It not only affects your body, it affects your mind too, and at the same time it affects your whole family. So whatever we do, we have to be in moderation. We have to be in control, and I would not say that gin or wine is different than other alcohols. Any alcohol is the same.
Lastly, sir, thank you for this interview. Last question मैं आपसे पूछूंगी कि any advice you would want to give to our audience या फिर 3 या 4 steps basic वो अपने जीवन में imbibe कर लें ताकि उनका heart health fit रहे.
Yeah. मैं पहले आपके साथ बात कर रहा था. I told you there are 3 components basically. One is the physical health. Make sure your physical health is good. That can be done by regular exercises, proper diet, keeping your weight under control, and third is your internal health, your liver, your heart, your kidneys. All that depends on what you eat and what you drink. Drink good amount of water every day. We usually recommend 2 to 3 liters of water minimum every day, and make sure you have at least a good mix of vegetables, fruits, and proteins. This will take care of your internal health. And lastly, but not the least, is your mental health. Make sure you have some hobbies, and take time to relax, at least by reading or whatever you like. You can even actually watch TV if it relaxes you, but not too much. Or photography or something like that. Go to the gym, do some exercises, and do some yoga, meditation, spend time with family. So all this is very good for mental health. So you need to balance your work and your family life. So that is very, very important.
Sir, also I would like to know कि what are the heart symptoms we should be careful of?
Yeah. Normally, what people think is only the left-sided chest pain or breathing difficulty. These are the main heart symptoms. Yes, these are the main heart symptoms, but there are other heart symptoms as well. Pain in the jaw, sometimes pain radiating to the left fingers. Sometimes it mimics gastric symptoms. If you have a lot of belching, acidity, indigestion, even that can be a symptom of heart disease. Sometimes back pain also. And many times when a patient is diabetic, long-standing diabetic, they won't have chest pain. They have is usually a kind of a breathing difficulty. So suppose you can travel, you can walk for 1 or 2 kilometers easily without any breathing difficulty. Suddenly, if the same person develops a breathing difficulty in the same kilometers, then he has to be careful. So he has to make sure that his heart is fine, his lungs are okay. So there are so many symptoms associated with the heart. It's not only chest pain. You can be also sweating. You can also have a back pain. You can have gastric symptoms. So we'll have to be very careful with all the symptoms.
थैंक यू सो मच सर. आई एम श्योर हमारी ऑडियंस को ये एडवाइस, ये इन्फॉर्मेशन बहुत अच्छी लगी होगी. और डॉक्टर सर के पास आपको जाने में, इतना इन्फॉर्मेशन देने में ही चार्जेस वेरी मच, लेकिन ये एडवाइस आपको फ्री में मिल रही है. आई एम श्योर आपको ये पॉडकास्ट बहुत अच्छा लगा होगा. कौन सा सेगमेंट था जो आपको बहुत अच्छा लगा, हमें कमेंट करके ज़रूर बताएं. और ऐसे ही इन्फॉर्मेशन के लिए देखते रहिए IBC 24. मेरा नाम है चारू अग्रवाल. नमस्कार.